Understanding blood clots during menstrual periods. Menstruation, a natural biological process, involves the shedding of the uterine lining. While it's a common experience for most women, some may notice the presence of blood clots during their periods. These clots can vary in size and can be a source of concern for many. What are blood clots? Blood clots are formed when proteins in the blood clump together to stop bleeding. During menstruation, when the flow is heavy, these proteins may work over time, leading to the formation of clots. However, excessive or large clots can sometimes indicate an underlying health condition. Common causes of blood clots during menstruation. Heavy menstrual flow. A heavier flow increases the chances of clot formation as more blood is expelled from the uterus. The longer the blood remains in the uterus, the more time it has to clot. Hormonal imbalances, hormonal fluctuations, especially those related to conditions like PCOS, polycystic ovary syndrome, or thyroid disorders, can disrupt the menstrual cycle and cause heavier bleeding, leading to clots. Uterine fibroids, these non-cancerous growths in the uterus, can cause heavy bleeding and irregular periods. The extra tissue can contribute to the formation of clots. Endometriosis, this condition involves the growth of uterine tissue outside the uterus. It can cause painful periods and heavy bleeding, leading to clots. Adenomyosis, similar to endometriosis, adenomyosis involves the growth of uterine tissue into the muscular wall of the uterus. This can also cause heavy bleeding and clots. Nulliparity, women who have never given birth may experience heavier periods and more clotting due to thicker uterine lining. Certain medications, some medications such as anticoagulants or hormonal birth control, can affect blood clotting and menstrual flow. Pelvic inflammatory disease (PID). This infection can cause scarring in the reproductive organs, leading to heavier bleeding and clots. Uterine polyps, these small growths on the lining of the uterus can cause irregular bleeding and clots. Cancer. In rare cases, cancers of the reproductive organs can cause abnormal bleeding and clotting. When to seek medical advice. While occasional blood clots during menstruation are usually harmless, it's important to consult a healthcare provider if you experience extremely heavy bleeding, if you need to change your pad or tampon more frequently than every hour. Large clots, if the clots are the size of a golf ball or larger. Prolonged bleeding, if your period lasts longer than 7 days. Severe pain, if you experience severe cramps or pain. Other concerning symptoms such as fever, fatigue, or unexplained weight loss. Diagnosis and treatment. Your healthcare provider may perform a physical examination, pelvic ultrasound, or other tests to determine the underlying cause of your heavy bleeding and clotting. Treatment options will depend on the specific diagnosis and may include medications to regulate hormones or reduce bleeding. Hormonal birth control to regulate menstrual cycles. Minimally invasive procedures to remove fibroids or polyps. Surgery. In severe cases, surgery may be necessary. Prevention. While you cannot always prevent blood clots during menstruation, maintaining a healthy lifestyle, managing stress, and seeking prompt medical attention for any concerns can help. Conclusion. Blood clots during menstruation can be a normal occurrence, but it's essential to pay attention to your body and seek medical advice if you have any concerns. By understanding the potential causes and seeking appropriate treatment, you can manage your symptoms and maintain your overall health. Thank you for staying with us until the end of this video. If you enjoy our videos, please give us a like, subscribe to the channel, and share your thoughts in the comments. Let us know what you'd like us to make videos about next.